Hello students, we will discuss a clinical sign today. Just to see what this clinical sign is. Look at this. Here in front of the ear, there is a swelling and the clinician is pushing his finger upward to look for some sign. So what this clinical sign? Naturally it has to be parotid or periauricular lymph node or subcutaneous swelling, whatever it is in that region, maybe from the skin, from the subcutaneous tissue, from the deeper part within the parotid fascia, it is a condenser deep fascia, we got parotid. So what this is to differentiate. One of the important sign is curtain sign that is seen in the parotid swelling. Deep fascia from the neck comes up and extends up as a parotid sheath which is attached to the zygomatic bone here. So any swelling superficial to this parotid sheath like lipoma subcutaneous or any cutaneous swelling, sebaceous cyst or whatever it is, it will move above the level of the zygomatic bone, whereas a parotid swelling will move only up to the zygomatic bone, because in zygomatic bone swelling it acts as a curtain like this, swelling will not go, whereas any swelling outside it will go upward. So that is called curtain. Sheath, parotid sheath or fascia acts as a curtain, prevents it to this parotid swelling to move upward above the level of the zygomatic bone. So that is called typically very popular curtain sign. If it is positive, that means swelling mostly from the parotid. So other features: obliteration of the retromandibular groove, raised ear lobule. If it is in front may not, but it's in this area it will be. And facial nerve should be examined. It's very, very important. Facial nerve comes out of the xylomastoid foramina and divides into two main branch and passes through the salivary parotid gland and between the superficial and deep lobe. That plane is called as a facio-venous plane of P, where retromandibular vein will be there. And so facial nerve should be assessed or analyzed clinically, important, because in malignancy it will infiltrate and cause facial nerve palsy. So then mobility, deep lobe involvement is the oral cavity examination, palpation of the duct, lymph nodes, opposite side, and other salivary lymph nodes like submandibular salivary gland lymph node and minor salivary gland, if at all, mainly submandibular salivary gland lymph node, both sides, and neck lymph node should be examined. There's a point you have to remember, and remember differential diagnosis. I said periauricular lymph node, lipoma, subcutaneous swelling, cutaneous swellings, all the things have to be thought of, because sebaceous cyst is also very common in the face. Facial nerve anatomy, salivary swelling, neoplasms, all the things has to be learned detail, both PGs and UGs, because it's a part of surgical curriculum. And so answer this MCQ. Warthin's tumor is common in females, is malignant, is seen in minor salivary gland commonly. It shows hot spots in technetium 99 scan. So what is the right answer on the comment box, and I will give the answer after that. So please go through this. All students requested to answer this one. So get involved with this discussion. Go through my clinical methods in surgery with the videos. It gives a proper examination of all important surgical conditions, especially for the exams, and in detail, of course, with the differential diagnosis. My manual of surgery current edition is covers everything, all topics for UG CBME syllabus. My surgical operation gives a detailed technical aspect, and tissue approximation shows how to approximate tissues. My DigiNerve lectures through JP covers everything for UG syllabus, specialties briefly, instrument, X-ray, specimen, clinical examinations, and images. So students, I hope you understood this lecture very well. Thank you very much.